Quick good morning to our media members here. We just wanted to get started just a little bit early to make sure everybody could connect with the new link. It looks like we're getting a pretty good amount of the media folks in. So I guess the link is working. So we'll go ahead and kick off at 11 o'clock as normal. We just wanted to kind of get started a little bit early to make sure everybody's connections were working with the new schedule.
Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, City of Amarillo Public Health Director Casey Stoughton, Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Emmentier, Chief Medical Officer for BSA, and Dr. Rodney Gonzalez, Director of the Amarillo VA. We're going to open it up to statements from our panel, and then we'll take questions from our media members who are in attendance. We'll start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm well, Dave. Thank you. And hello, Amarillo. Well, I want to start with just a little bit of economic data about where Amarillo is and where the Panhandle is, because certainly COVID has affected our economy. I'm proud to say that we seem to be rebounding quite well. Activity like large projects, new projects that are coming online. Amazon Distribution Center is under construction. The Texas Tech Vet School is under construction. But recently this week, we were named the top in the state for the unemployment, but our records and data are showing that 2/3 of every Amarilloan who lost their job due to COVID have already a new job or their old job. So it's a good statistic for us. You know, the United States is projected to have growth in its retail sales this year of 3%, but the number projected for Amarillo for things to come over the summer and the last few quarters of 2021 for our local businesses and our retailers. All of that economic data, one more piece of information, compared to this time last year for sales tax data that we have, we are 8.76% ahead in sales tax revenue. So that what that shows us is that our retailers are doing good and our local shoppers are investing and shopping at home. And it really does affect our economy for us to shop locally. So I want to say thank you to everyone in the Panhandle who is shopping at these local retailers. That economic data ties directly in, I think, to the good job that our public health department and our medical community has done in getting our community vaccinated. We're still one of the highest vaccinated per population per head cities across the state. And we need to keep it that way. So we're doing everything we can to continue having conversations about how to increase your opportunities to get vaccines and make it as easy as possible for you to come and get a vaccine. So stay tuned as we continue to roll out new options for those who are vaccinated. Casey obviously is going to have lots of information about that in the coming weeks. But the most important thing is to get yourself vaccinated. And if you've been vaccinated, then start working on your friends and your neighbors to get a vaccine for them. Thank you, Dave. That's all I have this morning.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you?
I'm well, Dave. Thanks. Happy to be here this morning. Happy to be in the city of Amarillo. It's a great, great community. As of yesterday, there were a total of 33,598 total cases of COVID-19 in Potter and Randall counties, 17,150 cases in Potter County, and 16,448 cases in Randall County. We have a total of 32,675 recoveries, and we're up to 715 deaths here in our community. That leaves us with 208 active cases. The 7-day rolling positivity rate is currently at 3%. That's up from 2% last week. The positivity rate at the drive-through testing site is at 10%, and the 5-day new case average is at 19 new cases per day. Yesterday, our GA34's hospitalization percentage was at 4.19%, and that means that 4.19% of all hospitalized patients have COVID-19. We're currently in status level yellow. The public health drive-through testing site remains operational. Individuals can call 378-6300 to be screened and directed to the test site. The vaccination clinic is also operational at the Amarillo Civic Center's entrance 3. Today, we will be open until 5 o'clock. For clinic times and other great information about vaccines and COVID-19, please check out amarilloalerts.com. All adults are eligible for the COVID-19 vaccine. That is great. We are very excited to be able to vaccinate all adults. We do have the Moderna vaccine at the City of Amarillo Clinic, and so we're able to vaccinate all adults over the age of 18 and over. So if you're 18, you're also included in that number. To date, Amarillo Public Health has given 68,227 first doses and 42,342 second doses for a total of 110,569 doses given. It's a lot of vaccine. If you need transportation to either the drive-through testing site or the vaccination clinic, please call Transit at 378-3095, and that's the City of Amarillo Transit Department. They have really done an outstanding job during this time of need. We couldn't appreciate them more. We've truly come a long way. We've worked hard together as a community, and I listened to a talk this week given by the director of the CDC who warned that we're not out of the woods yet. We have been fortunate here in Amarillo to see our numbers drop, but like the CDC director warned, we've got to stay vigilant, wearing our masks, social distancing, staying home when we're sick, and getting the COVID-19 vaccine in order to keep cases down, and holding off another surge of cases are so important. So I just want to encourage you to stay the course. Like Mayor Nelson said, we are rebounding very quickly, and that is wonderful. We definitely want to stay on that course. So please continue to be vigilant with the public health efforts, such as masking and vaccination. Just want to give you that word of encouragement today. I sure appreciate all of your hard work. That's all I have today, Dave.
Thank you, Casey. Let's now go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you?
I'm fine, thank you. First of all, just wanted to make clear to everyone that I'm in my office alone. I have my mask here, and as soon as I leave my office here at Texas Tech, I'll be putting on my mask, as everyone is here still. Just to drive home a couple of important points about the vaccine, which I think is the game changer here. Let's remind everyone this vaccine is free, so there is no cost to this. Any adult can receive the vaccine, as Casey and the mayor have stated. The vaccine is very effective at preventing illness. In other words, especially preventing severe illness, like those that would be in need of getting medical care, being hospitalized. It's also very effective in preventing transmission. We've been wondering about this for quite some time, but there's more and more data that actually proves that it seems like it is very effective in preventing asymptomatic transmission. The vaccine is safe. We've given out, as Casey stated, more than 100,000 doses. The side effects are minimal and they are short-lived. And then think about this. If you get sick from COVID, what we know from being in the hospitals, the medications are just not near as good as this vaccine. So it's clearly best to prevent this by getting vaccinated. And then finally, if you're not vaccinated and you're exposed to someone who has COVID and you're not wearing a mask, you'll be asked to be quarantined for at least 10 days. So think about the inconvenience of that. Not only personal inconvenience, but the problems related to employment and the general economy here, the implications with that. So there's just so many good reasons that we need to get vaccinated. We have plenty available. I want to encourage everyone that's not been vaccinated that is eligible to do so. Go to the Civic Center. We have plenty. That's all I have, Dave.
Thank you, Dr. Milton. Now I'll go Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Good morning, Dave. Well, I am pretty chill. My 13-year-old daughter, Valerie, says I really need to work much harder at achieving this mental state. So while we're in the reprieve of the COVID right now, I'm working on being pretty chill. But so anyway, yesterday I was on a call from the Texas Department of State Health Services. And, you know, overall, they said that the numbers are down across the state of Texas, which is great. But, you know, as kind of alluded to on this call already, one of the commentators said, we cannot be sure if we're in the eye of the storm or truly on the backside of the storm. And that's important because, you know, clearly right now we're looking good. But again, the conversation turned very rapidly to these variants, these mutations we talked about. And what they said is that with regard to the UK variant, the more common one, we're almost up to 500 confirmed cases of this in the state of Texas. Now, we knew this was 50% more transmissible. Problem is, now the data shows that it's 67% more fatal than the wild type, meaning that for every 3 deaths from the original COVID-19, this UK variant would result in 5 deaths. So this is the big threat on the horizon. Now, there's also a South African variant. I believe we've had 2 confirmed cases in Texas. And then the latest kid on the block is this Brazilian variant. And what they said in Brazil, this variant took part of that country from 1,700 hospitalizations to over 7,000 hospitalizations in a matter of weeks, actually caused a collapse of the public health system there. So this one now is also yet another threat that we have to consider. So, you know, I think in terms of the vaccines, again, you know, the more I hear about these vaccines, the better. I mean, these are just marvelous accomplishments of science. And as Dr. Milton alluded to, there's data now. There was a study that looked at 4,000 people who got the vaccine. What they showed is if you got both of the Pfizer or Moderna vaccines, you had less than 1 in 10 chance of being an asymptomatic carrier of this virus. If you only got one of the vaccines, at least 14 days after that, you had less than a 1 in 5 chance of being an asymptomatic carrier. So what's telling us is that you just cannot get this virus if you got those vaccines. So again, all the more important why we need to all work on trying to get ourselves vaccinated. Now the vaccines are shown to be safe in pregnancy, and they're even showing that the mother can transmit some of protective antibodies to the unborn infant. So that's very exciting. I think you're going to see a big push on trying to get women who are expecting vaccinated. The last thing that came up on the call was the antibody testing. Now, I know I have gotten personally several calls from people that said, you know, I got both vaccines, and then someone tested my antibodies and told me I don't have any antibodies. And this has been rather confusing. So what we know now is the majority of antibody tests that are being done are tests for an antibody against the nucleocapsid of the virus. That's the inner part of the virus. Well, the vaccines are generating antibodies against the spike protein, which is the outside of the virus. So we're looking for the wrong antibodies. So only certain antibody tests will detect the vaccine-generated antibodies. And I know at Northwest we have that test. And what we found is those who were told they had no antibodies, when we test them, they're teeming with antibodies to the spike protein. So please don't get alarmed if you're getting tested and say you don't have antibodies. The recommendation from the state health department was don't bother getting tested. These vaccines are so good. So let's talk about the numbers at Northwest. So right now we have 13 positives in the hospital. That's 2.6% of our licensed beds. Now we still have yet to be able to drop below double digits, but we've been approaching that. Now we have 38 patients in our ICU, only 4 of which are suffering from COVID right now. And we're using 16 ventilators at the hospital, only 2 for people who are suffering from COVID. You know, in the month of March, we have had 6 COVID-related deaths. Now that's 6 tragedies, but what a difference from where we were 4 or 5 months ago when we were at 70 plus people losing their life from COVID in a month. So 6 in a month, we continue to move down. Hopefully we'll get to 0 very soon. Now, outpatient testing, we had a 4% positivity yesterday. Now, it was interesting. For the last 2 weeks, we were somewhere between no more than 1 and 2% positivity. And then as of this last weekend, we hit 5%. We've been tracking at 4 to 5% over the last 4 to 5 days. I think it's still too early to say that is a trend, but I sure would like to see it go back down to that 1 to 2%. With regard to remdesivir, which is the inpatient medicine we're using right now, we have 4 patients on remdesivir. Now, the interesting thing is Dr. Milton commented on some of these medications not being nearly as effective as the vaccine. Well, bamlanivimab is that outpatient antibody that we've been using. Well, turns out that is not particularly effective against some of these variants. And what the recommendations are now is that in areas where the variants are raising in terms of the prevalence, is now we need to combine 2 monoclonal antibodies. Like I know what BSA is using, which is the Regeneron cocktail, which is 2 antibodies. So bamlanivimab may have to be combined with a second one to really be effective if we see more of these variants start to increase in our community. Lastly, in terms of our staff, now, so the RAC is going to demobilize all the visiting staff pretty much by the end of April. So I know certainly we are working on stabilizing our employed nursing staff and respiratory therapists, as is BSA and most other facilities. But end of April, we anticipate probably having most of the visiting staff leave. So lastly, I'd just like to thank the city and the public health department for the incredible job they've done with these vaccines. I have family in other parts of Texas, and no one has had as easy a job of getting a vaccine as people in Amarillo have. So I would highly encourage, please get your vaccines. And then also, as Dr. Milton said, at Northwest, we are still not lowering our protective standards. We are still requiring masks in the hospital. We're not quite ready to make that step yet to really let our guard down. And I think it's important for all of us to continue to do that until we're way in the clear and that we know these variants are not going to pick on us. That's all I have for today. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm good, David. Thank you, and good morning, Amarillo. And I think that it's a good period for us right now in terms of being in a much different place than we were back in early November. We actually have our surveyors here today that do our yearly and annual accreditation. That's the DNV organization, and part of our required discussion with that group is to talk about what we did for the COVID pandemic. And we went through from start to finish, kind of told our story about COVID-19 and how it affected our hospital and what we did with PPE, what we did with quarantines. And we talked extensively about the collaboration that we had in the city of Amarillo. BSA, along with Northwest Texas Hospital leadership, myself and Dr. Weiss, not just on these meetings, but on multiple calls a week about different topics. The public health leaders, Dr. Milton and Casey, our mayor, Mayor Nelson and her team, and how really we all stepped up and have collaborated, and how impressed they were during our early meetings this morning when we told our story about how that led to the best care for our patients and the best outcomes for our city. So I think that's important to mention today. I also want to mention today that yesterday was National Doctors Day. And I think that we all would echo what I'm about to say, which is that we want to thank all of our doctors over the past year and into 21 as well for all of the hard work that they've done to take care of COVID patients and other non-COVID patients over the past year during extenuating circumstances where they were working excessive hours, excessive shifts, seeing excessive numbers of patients beyond their norm in order to cover their comrades, to take care of very sick patients, and to make sure that no one went unseen and uncared for. So if you see a physician or you have one in your family over the next week, please thank them once again. It's a day of recognition. Yesterday was. As far as the numbers at BSA today, we have 10 cases today. We were down as low as 7 earlier this week. We're hovering in that kind of 7 to 12 range as far as inpatients. Only 3 of those are in our intensive care unit, and only 2 of those are on the ventilator currently. Very different than where we were previously. We're only using about 12 ventilators right now, and we're using very little of our high flow nasal cannula oxygen apparatus because, again, we don't have that need at this time, but we're prepared for another surge if one comes. We have very few staff that are quarantined. Those staff that are quarantined, almost 100% are individuals who have not been vaccinated, or they may have been early in their course and only had one vaccine and therefore are not fully protected, and we've had to quarantine with an exposure, not because they are significantly ill. And that is a significant improvement from where we were. That's almost now with 300 inpatients at BSA, very few staff members quarantined, which is critical because, as Dr. Weiss mentioned, we're now in that demobilization phase of the RAC support staff, nursing and respiratory therapists that are leaving our facility in a step down fashion, which is expected at this time because the demand is no longer there. I think it's important for us to talk about a couple things. I think Doctors Milton and Weiss and I all read the same articles this past week regarding more data on vaccinations, but I'll say the data a little differently, but it's the same study I think Dr. Weiss mentioned, and that is that they looked actually beyond the phase 3 trials, which already showed good data as far as efficacy of the vaccines. This was a study in healthcare workers that looked at those who were vaccinated and post-vaccination from mid-December through mid-March. For individuals who had 2 doses of the messenger RNA vaccines, the vaccine was 90% effective in preventing infection. 80% effective after 1 dose. And again, that's consistent with the numbers Dr. Weiss mentioned. And for those that became infected, for 60% of them, 60%, they only knew that they were infected because they were doing serial testing throughout this trial to confirm if they got infected post-vaccination, meaning they had no symptoms, which means that even if the vaccine doesn't prevent you, one of these vaccines doesn't prevent you from getting infected, you're not going to have a significant infection in almost every case. You're going to have mild disease, which will not lead to this fulminant COVID presentation, which unfortunately has caused hundreds of individuals in our counties here over the past year to succumb to the illness, both those with and some of those without comorbidities, which we must also remember. So there's more and more data about the efficacy of the vaccines, the safety of the vaccines. Also, there's ongoing data, the reduced risk of transmission of the virus. And I'm also hearing additional details that we probably all are on this panel about concerns from folks about infertility with the vaccine. And I'm not sure where that's coming from, but there is no data to support that that is the case. And please be careful about the sources where you're getting some of these comments about what potential side effects exist with these vaccines. There is no data to support that. And we just need to underscore what the risks are for those that get severe infection. Monoclonal antibodies, Dr. Weiss mentioned, because of the variant disease, yes, it is a concern now. And we talked in our system last week about the concern with giving sole bamlanivimab as a monoclonal, and we are going to be aborting that practice effective immediately. We are continuing to use Regeneron, which is a dual cocktail of 2 monoclonal antibodies, and we are also going to purchase some of the available etesevimab, which is a second drug that needs to be paired with bamlanivimab, 2 monoclonal antibodies that will work like the Regeneron. There's also an EUA out for that combination so that we could, again, prevent some of the resistance to therapy if we prescribe the therapy to those individuals. But as Dr. Milton mentioned, those therapies are good and they're saving lives and preventing hospitalizations, but they're not as effective as the vaccines. You don't want to be in a situation where you're getting the treatment. You want to be in a situation where you got the preventative medication, which is the vaccine, in order to prevent severe illness. So please remember that. As far as the variants go, we've had only 2 patients that we had suspicion on at BSA that could have variant disease. We just found out about these recently, and these have to be sent out to a special laboratory as requested by the state, and the state actually contacted us. The first concern did not pan out to be evidence of a variant, and the second case we have is pending. this is not a shock. This is not a surprise. Dr. Weiss mentioned the number of cases that have been documented in Texas. The variants are probably already here. We are going to at one point say that we have a certain percentage of them, and your best defense is vaccination. In addition to masking, in addition to good hand hygiene and social distancing. So I also strongly encourage all of those things. And again, we will keep you updated in terms of where we stand with our latest statistics, but at this time, we are in a much better state, certainly, I think because of multiple factors, some herd immunity, the vaccines as a big piece, and our good practices in terms of masking. That's all I have today. Thank you.
Thank you, Dr. Lamentier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, David. Thank you for allowing me this opportunity. So I'm coming to you today from the Clovis VA clinic. We're doing our second dose Moderna vaccinations here. We did the first dose 4 weeks ago. And of course, we've got some additional Moderna and some of our Johnson & Johnson vaccine for veterans that want to be vaccinated. It gives me a time to just give a quick shout out to some community partners, specifically here in Clovis, the Clovis VFW 3015 that's allowed us to use their space. If you've been to our Clovis VA clinic, it's very small, and getting through a few hundred people would be very difficult. So having that, and then last week we were in Childress and at the Elks Lodge there, allowing us to use their space to vaccinate veterans. So quickly on our numbers, currently we do not have any inpatients at the Amarillo VA with COVID-19. We discharged a couple over the weekend, so that's good for us. Now on our vaccinations, we've been doing pretty well on vaccinations, but we have seen a taper off of veterans coming in for vaccinations. We have vaccinated about 33% of our veterans across the healthcare system. And that means either we have given them the vaccine or they have provided us a copy of the card so we can document their vaccination if they got it outside, such as at the Civic Center or some of the local pharmacies that are doing the vaccination. We do have both Moderna and Johnson & Johnson available at both our Amarillo VA and our Lubbock VA campuses. At the Lubbock, they do walk-ins they do appointments and walk-ins on Thursday. At Amarillo, we pretty much do walk-ins every day of the week, Monday through Friday, and we've been having Saturday clinics also. So encourage veterans. While we are seeing a good decrease trend of numbers, I want to remind everyone what got us there. What got us there was doing wearing our face mask, practice social distancing, staying home when we're ill, good hand hygiene, and vaccinations. The vaccinations, even the influenza season in October, we talked about the importance of getting that influenza vaccination. And I can tell you at the Amarillo VA, we have not had, we had one back in October influenza case. And I know the cases across the community have been near non-existent. And so it just shows that what vaccinations can do. So really encourage you, if you have not been vaccinated, to strongly consider coming either to the Civic Center, one of the local pharmacies that has a vaccine, or to the Amarillo VA if you're a veteran, and we will get you vaccinated. As mentioned earlier, yesterday was National Doctors Day, and I want to give a special shout out to the doctors on this panel. We've learned a lot going through COVID, and I think the one thing we learned, and Dr. Lamentier mentioned it, was how teamwork can really allow us to accomplish a lot. And so being able to work together, not as separate healthcare systems, not as a separate, well, that's the city's issue, not the hospital issue, but working together as a team and coming together about how we've been able to really handle this pandemic in the Texas Panhandle area. Other thing I want to mention is Monday was National Vietnam War Veterans Day. I've mentioned in the past things about the Vietnam War. And, one thing I always mention is I got a great welcome home when I came back from my deployments. Honestly, couldn't be prouder to be wearing that uniform as I came home. That was not true of many and most of our Vietnam War veterans. And so just want to give a shout out, thank them for their service. If you know a Vietnam War veteran, please just tell them how much you appreciate their service to our nation. I do want to thank our staff who have been doing an outstanding job caring for those that have served, and appreciate all our staff does each and every day. And with that, I just want to thank the city of Amarillo, our communities throughout the Texas Panhandle and Eastern New Mexico for this opportunity.
Thank you, Dr. Gonzalez. Now I'll go to members of our media. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with, if I'm not mistaken, Kevin Welch of KFDA, News Channel 10. Kevin, how are you?
Hi, Dave. I'm good. Say, Casey, how are the numbers, the turnout Monday when the new category was opened up, and then this week, did it continue or did it taper off like Dr. Gonzalez was talking about?
Yeah, that's a great question. So we did see a little bit of a bump in our numbers, and we're really glad about that. We certainly want to vaccinate lots and lots of people. We do have vaccines still available, so if you haven't been vaccinated, now's a great time to come see us.
Okay, and speaking of that, is there are there any trends about what time of day that people are showing up at the clinic? I know driving by at lunchtime, the parking lot's like vacant.
Yeah, you know, we have early risers here in Amarillo, Texas, and so usually people, the lines are the longest first thing in the morning, you know, early afternoon into the, you know, later in the afternoon. It's usually, you could probably walk in and get a shot pretty quick, because we definitely have people who like to line up first thing.
Okay. And are you working with the jails, local jails, Potter and Randall County, as far as vaccinating inmates?
Yeah, so we have reached out to them and are working with them to make sure that they have the supplies that they need.
Okay. And DSHS had recently announced an online scheduler. Are we going to remain strictly walk up?
For now, yes. And then if there is a point in time that we do need to make appointments, we have a system that ties into our EMR system. And so we probably won't use the DSHS provided scheduler, but we certainly, it's a great tool. So I'm, you know, thrilled that, that it's there for communities that need it.
Okay. And since you're on that advisory panel for at the state level, can you describe what the thinking was for not vaccinating prison inmates as the different rollout phases came along?
So I think that that was happening kind of simultaneous to, you know, especially during the 1C rollout. So I know that the Texas Department of Criminal Justice System has been working with Texas Department of State Health Services. I think that you would certainly have to ask DSHS about the specifics of that, but okay. I do believe that that they have been requesting vaccine and receiving the vaccine that they need. When I talked to the Clements unit last week, they said that they had been receiving the vaccine that they needed. So for more specific details, I think that DSHS would be the best source. Okay.
And the last thing is, do you, to remain a hub, is there some kind of expectation of how many people that you're vaccinating over time?
Yeah, it's, you know, we need to keep, certainly, you know, keep our numbers up. And so we definitely need help from our community to do that. We need to, you know, see numbers, but it's, you know, 1,000 to 2,000 people. And I think it may be, I don't remember if it's a day or a week. So certainly we want to make sure that we're having lots of people come. So if you haven't gotten your vaccine, again, now is a great time to come.
Great. Thank you very much.
Mm-hmm.
Thanks, Kevin. Let's now go to Dalton Williams, AVI Channel 7. Dalton, how are you today?
I'm good. Thank you all for having me. My first question is, Casey, I know you had spouted out the numbers earlier. Do we know off the top of your head or just anywhere what percentage of the city has been vaccinated so far?
Yeah, I did that math just the other day. So around 30% of the adult population has been vaccinated. here for the greater Potter Randall County area. So not specific to the city, but just, Potter and Randall counties, around 30% of the adult population. So that's great, and we're certainly making great strides. We need, again, just that call for people to be vaccinated. I think each of the physicians on the call gave us great information about the safety and the efficacy and the greatness of the vaccines. Vaccines have been one of the things that have saved so many lives over the last couple of generations, that we don't see the diseases like polio and diphtheria and many other diseases that we have vaccines for. And so this is just another one of those vaccines that is saving so many lives. And so just another call for people to be vaccinated is what we have today.
Right. And then I believe, if I'm not mistaken, it takes 80% of this population to reach herd immunity. Any of the doctors can probably correct me on that. How soon, in y'all's kind of just like professional opinion, do y'all think we could reach herd immunity, like with us being able to vaccinate so many people now?
So, as long we continue to receive vaccine from the state, and again, just that call to the community to come to be vaccinated. So right now we have around 30% of our adult population. So, we just, continue to need people to come to be vaccinated.
I could just make a couple of comments about, the thought of herd immunity. Certainly a significant number of people have been infected naturally through this pandemic. And then finally, what we've all talked about are the variants. Variants, especially, I believe the British variant, is much more contagious, and so that could potentially skew the number of people upwards that we'd have to have vaccinated in order to reach herd immunity. Another analogy for that is that, in order to reach herd immunity for measles, which is probably the most contagious virus that's known, you have to have more than 95% of the population vaccinated in order to reach herd immunity for that. So I think that's the variable here, is the prevalence of variants. And once again, it brings out the point that we have to vaccinate people as quickly as possible. It really is a race, I think, to vaccinate as many as possible.
Okay, and then kind of my last question is, now that we are allowing everyone to get vaccinated, I know you had touched on a contingency plan, Casey, in case we ever do need it. Are we concerned at all about possibly running out of doses anytime soon, or is that kind of just a far in the future kind of aspect?
I would love to run out of doses. If we could run out of doses and give everything that we had in our freezers and refrigerators, that would be a great day. But I'm not really concerned right now about running out of doses. The snowstorm gave us a little bit of a supply to last. And so I don't believe we're at risk especially this week, of running out of doses. So if you haven't been vaccinated, again, please come to be vaccinated. That is what's, we're all in this one together. So we have to all be vaccinated together to get out of it.
Okay, awesome. Thank you all so much. That's all the questions I have. Y'all have a great day.
Thank you, Dalton. Let's now go to David Gay of the Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody. I guess my first question is for Dr. Weiss. Dr. Lamentier spoke about 2 potential patients being tested for the variant. Have any come from Northwest as of today?
Yeah, Dave, great question. So we are doing the same thing. We are sending a lot of these samples of positive patients to be sequenced at the state labs. I spoke with our lab director recently. At this point, we do not have any confirmed variants at Northwest, but there are some still pending. So it does take a couple of days for that to return. But yeah, we're looking as best we can.
Absolutely, absolutely. And I guess another question for you, Dr. Weiss. So you spoke about the monoclonal antibody, especially with the potential with this variant with the BAM infusion not necessarily being as strong. Is there, are you guys like BSA kind of getting rid of that BAM treatment and going to something else, or what is the plan for Northwest?
Yeah. So one caveat, which is tricky, because what they said in areas of high prevalence of the variants, then we become more concerned that these antibodies are not going to work. Now, as far as I know, we're not quite there yet. And I was talking to my head pharmacist today, the director, about, okay, do we still offer it as a monotherapy? But what we would do is we're going to do similar to what BSA is doing, which is order the second antibody that goes with it. So that, as we start to become more concerned about these variants being in the community, we can add that second antibody and give a cocktail, just like BSA has been doing. So we're kind of on the same page there.
Absolutely. And I guess my next question is for any of the doctors, Dr. Milton as well. With the individuals down in Lubbock announced a few days ago that there was one case of the variant in the community. Is it like what Dr. Lamentier spoke about? Is it just a matter of time for this variant to be in the Amarillo community?
Well, I would say that my approach to this whole thing is that we always should assume that the variants have been here. The testing, I think the testing for the prevalence of the variants is a little bit better now than it was when we first recognized that this was a problem. So we couldn't screen as well initially. It sounds like this is a little bit better now, but I think that it's very likely that we've had variants here for a while. I'm just really grateful that we've been able to vaccinate as many people as we have, because I think that's helped us. I don't know if any of the other doctors have any comment about that.
I would just share the view of Dr. Milton. I think it's only a matter of time before we start to see these achieve a higher prevalence in our community. That's Mother Nature. She knows how to get around a lot of our tricks. So yes, I mean, we're being prepared to face what may be some form of surge. Hopefully not nearly as dramatic as the two we've seen so far from these variants that are a little more infectious and unfortunately a little more dangerous.
Yeah, I would agree with everything said by both Dr. Milton and Dr. Weiss. As I mentioned earlier, I think I agree with Dr. Milton. The variants are already here. Probably the incidence of how many are here, I mean, all those questions we don't know the answers to. But the real important point to make, though, is, will it matter? And I would argue that it won't really matter for individuals who are vaccinated, almost certainly. But it certainly might matter for those who are not vaccinated. And that's where we're getting nervous about really understanding and trying to encourage why, number one, understanding why someone would not want to be vaccinated. And number two, encouraging those who do not have a good contraindication to having the vaccine. And there are some that do have a contraindication, but very few. That's a medical reason. Please seek vaccination. We are one of the first states in the country to be able to vaccinate individuals that are now 18 and older. Talking with family members, as I'm sure many of you do across the United States, and friends that are in different areas, some of them are not able to have this luxury right now. And I'll call it a luxury, which means that all adults now can be vaccinated. And please don't assume that you're going to be immune and not have an issue just because you're younger and healthier. We've seen individuals like that succumb to this virus. So please remember that the variants might not matter at all if you have immunity because of vaccination.
Sure, absolutely. And I guess the last question is a follow-up for Casey. Once those, I guess, first variants are announced, is that something that could potentially be added to the COVID-19 report card, just depending on how many are in the community?
Certainly something that we'll look at. It is the sequencing, like has been talked about, takes time, and not every specimen is sequenced. And so I would So there'll be some conversation around that. We certainly want to make sure that the public has all of the information that they need and want, but also that we're giving accurate information. So certainly more to come on that.
Absolutely. That's all the questions I have. Have a good rest of your week, y'all.
Thank you, David. Let's now go to KAMR Channel 4. I think we have Aaron Langston. Aaron, how are you?
Good. How are y'all?
Good.
First question is, since we've had a fair number of people from outside the Texas Panhandle coming in to get vaccines, and the fact that we are one of the first states in the country to offer the vaccine to everybody, have we seen an increase in the number of people this week coming in that fall under the 1C category compared to what we've seen in the past?
No, I think it's been a really great week, and I think, we've seen lots of people locally be vaccinated, and so we've had a really great week.
All righty. And that does it for me, but Judd has a question.
Hi, I just wanted to ask all of the doctors on the call. The CDC director said in an interview on Monday that current data suggests people who have been fully vaccinated do not carry COVID-19. I know some of y'all kind of touched on this during the briefing. In the data and the studies that you are reading, are you kind of also seeing what the CDC director said in her interview?
I say that was kind of the same data I think that both Dr. Lamentier and I alluded to, because that was been the big fear up to this point, has been even in people who are vaccinated, could they carry the virus and spread the virus as asymptomatic carriers? And right now, the latest data out suggests that is most likely not the case. So I think that's what she was alluding to was, boy, it looks good. It looks like this vaccine prevents someone from being an asymptomatic carrier, as well as, almost makes it impossible for them to be critically ill or symptomatically ill, as Dr. Lamentier was saying. So the news just gets better and better about these vaccines all the time.
I would agree.
Okay, thank you. And then I have one second question. Pfizer announced today that its COVID-19 vaccine is safe and strongly protective in kids as young as 12. In your opinion, would vaccinating children of all ages be critical to stopping the pandemic and truly helping schools, at least maybe the upper grades, start to look a little more normal?
I think so. And I think that, as soon as the EUA and the guidance, the licensure changes, then we'll be, able to make those changes along with it, with the vaccines.
All righty. I think that has us covered. Thank you all very much.
Thank you, gentlemen. At this time, this concludes our news conference for the latest in COVID-19 information for the community. I want to thank all of our panel members who took the time to join us today. Thank you for your expertise and your knowledge in the subject. We'll be doing one again next week. Next Wednesday, 11 a.m. We will send out information to the media on that as soon as possible. Once again, this is David Henry. I'm the Communications Manager for the City of Amarillo, and I want to thank everyone for joining us. Thank you.
Thank you.
Thank you.